I'm Derek. Nice to meet everyone
Hi,
here. Such a big crew. I started SoftWave by Molotherapy. Movement you love is therapy. SoftWave regenerates tissue so you can enjoy movement you love. We're here to help you heal yourself. But today, I just wanted to introduce all of you to SoftWave. Not very many people know what that word even is. I'm hoping to make it a household name one day. Our mission is to help people get back to movement they love, pain-free. And so we tried to do that with SoftWave and strength training combined. These are some common questions that I usually get. We'll just go one at a time. What is it? If someone were to ever ask you what is SoftWave, you could just say this. It's a medical device that regenerates damaged tissue. What does it treat? It treats many things. The three things we use it to treat are orthopedic injuries, like arthritis, tendonitis, shoulder pain, back pain. We treat urological disorders like erectile dysfunction, pelvic floor pain, and we treat wounds and burns because it regenerates tissue. So a majority of the time we just treat orthopedic injuries, but it can treat a lot. How it works, I could talk about that for probably 30 minutes, but to simplify it, it's a principle called mechanotransduction. That just means that your tissue gets loaded by the sound wave when it hits your skin and your tissue, and then it causes a huge thing of communication. It makes all the cells in your body start talking to each other, and then it starts processes that result in reduced pain, improved blood flow, and the regeneration of tissue. So I'm loading your tissue to create a response in your body. So I'm not adding anything new in, it's all internal. And so we're just causing communication between cells. Treatments, we only do 8 treatments max. We do them about once a week. Treatments usually last like 7 minutes. I'm really not shocking you for very long. And right after, everyone usually says, wow, I feel pretty loose, or I feel a little numb. That's usually what they say.
Per body part? Per
body part, yeah. And so, like if we're working on a shoulder, we've had crazy testimonials where like a guy literally got ran over by a truck at a stop sign. Guy was smoking weed and he just ran him over. And he had surgery on his neck and his lower back. And he came in with like a walker, and he couldn't move. We shocked his lower back and his upper back, and afterwards he could touch his toes and he could twist. It was crazy. We've shocked other people though where they have like torn rotator cuff, and we shock it, and right after their mobility is the exact same. So it kind of depends per injury, but everyone usually walks out feeling a little better. And I always tell them you're not allowed to leave until you feel a little bit better. The side effects, I mean, if you count feeling good as a side effect, not really. The only one might be like you might feel a little more tender. That's really about it. The only contraindications of what we will not treat is anyone with a pacemaker. We won't work on the upper left side of their body. We don't work on anyone who's pregnant on their stomach or back, because theoretically the shockwave could break up the embryo. So we don't even want to try that. We don't work on anyone with active cancer because this does replicate cells. So we theoretically don't want to replicate cancer cells. We don't work on anyone with steroid injections for at least 3 weeks, because you have to feel this to heal it, and if it's numb, not really effective, and it can actually make it hurt a little more afterwards. So that's why we don't work on them. And we try to stay away from growth plates on anyone under 16 for more than like 500 pulses. So that's what we're usually staying away from. We still work on kid athletes. We just stay away from growth plates for an extended period of time, because theoretically you could increase ossification of growth plates and seal them. But that's all theoretical. So that is side effects, but the last question is the most important, because if the answer was no, then you would not have cared about any of the rest. Does it actually work? The answer is yes, in our opinion. Our clinic, we've been boasting an 85% success rate of helping people get out of pain and back to movement they love, and our goal is 100%, so I'm always learning. I'm trying to learn different techniques of what we could do, but for right now, we're just at 85. In SoftWave, I started this business because there was a problem and I wanted to provide the solution, which is SoftWave. But the problem was that people are in pain, are not functioning properly, which then can inhibit them from enjoying movement they love, which then can stop them from being available to people, their loved ones, and enjoying movement they love for as long as they'd like. So that's the problem. Our solution, though, I call it the MOLO method with SoftWave. And so we try to provide pain relief and functional relief by addressing these 3 issues. We try to address structural issues, functional issues, and then form of life issues. Structural issues is what SoftWave addresses, like a torn muscle, sprains, strains, arthritis, tendinopathies, reactive and degenerative. 90% of the time, SoftWave will get rid of your pain just because we address structural issues. Like, this is low-hanging fruit. If someone still had pain after we do 8 treatments of SoftWave, we wait 4 weeks, I would not go back to SoftWave. Then we move to like functional training. So functional issues, whether it's like increasing tendon stiffness, muscle elasticity, extensibility, contractility. So mainly what we're doing is just working on mobility, balance and coordination, power, strength. Strength is your ability to exert force, and power is your ability to do that really fast. And so that's what we'll work on functional issue-wise, because I do believe weakness can cause pain, lack of stability. Pain is just your body's request for change. And so if we can make everything stable, sometimes it will turn those pain receptors off. If you still have pain, that's when we start looking at more of form of life. So that's like, hey, what's your hip extension like? How often do you spend time sitting on the ground? How much water do you drink? How many steps a day do you take? How much protein do you eat? Fruits and vegetables, do you ever even look at them? That is, and we usually talk about that while we're shocking people. Each treatment, we kind of just ask questions. How are you doing? But those are the 3 things we try to help with. If it's like food-related issues, refer out. If it is like an adjustment that's necessary, like if someone is subluxated horribly, I don't think SoftWave is really going to help them. I'm like, you need to go get an adjustment if you want any relief. Like, I can shock it all day long, but you're still subluxated. So these are some of the fun photos we've taken. Pretty crappy photo, but this was a lady. She was bone on bone in her knee. She weighed 400 pounds. And surgeon said, you need a knee replacement. And she was like, I don't want to. So we did SoftWave, and you can't really see a whole lot. It looks a lot different now. I wish I had that image in here. But our surgeon came in. He said, hey, you don't need surgery. And she said, seriously? She was like, why does it still hurt? He said, because you weigh 400 pounds and you keep walking on it. And so then she lost 200 pounds and all her pain is gone. So that was a really cool story. This is a video. It probably will not play for my luck. This is Monty. He loves SoftWave. He came in for erectile dysfunction. We've had a 99% success rate with that, and he is 60 years old, and he said, yeah, I feel like I'm 17 again. We get the same reports from guys that are 80 years old. We work on Amish patients. We'll go out there, 80 years old, and they're like, I heard you can make me able-bodied again. I'm like, yes, sir. So that's fun. This is Hannibal. He's a coach for Mizzou football. He's had lower back pain since he was in college. He's like around 39. And he had tried everything. He's like, I'm just going to live with back pain. We shocked him. His testimonial is just that he can do power cleans again without pain, and he can live his whole life, and he's pumped. And then this is Nancy. Nancy's awesome. She had elbow issues, and when she was sleeping at night, and it just kept waking her up. And so she said around treatment 6 is when all her pain went away, and she can sleep all the way through the night now. So, which is helpful. I really like her testimonial, because sometimes people just want to, so one treatment will take everything away, right? And I'm like, no. You know, we're not going to make you Wolverine or Deadpool where you just regenerate instantaneously. It takes time. Every time, like if you feel better, it's not because we regenerate tissue, we just decreased inflammation. And so you walk up and you're like, oh my goodness. And we also send a bunch of current through your nerves, and so maybe just like neuromodulators. So you're like, oh, I can enjoy a better range of motion. But Nancy has done SoftWave a lot. We've worked on a lot of her. So we've done her shoulder, her knee, her elbow, and she's just working on the line of her body. That's really about it. So.